Hi, good evening. Thank you
Hello,
for
Doctor. Yeah.
thank you for joining us. I'm Dr. Carrie Mendoza. I'm running for Lieutenant Governor of Illinois with Ted Dabrowski. And I am also an emergency medicine physician who grew up here in Illinois, really concerned about what's going on in the state. And tonight we're going to talk about, the assisted suicide bill that went through the Senate and is on Governor Pritzker's desk. And I am so honored tonight to have Mary FioRito with us. Mary's an attorney, public speaker, radio show, and podcast host. She's very expert in the issues of human life, especially she's done tons of work on issues around assisted suicide and euthanasia. She has her JD from Loyola University School of Law, and she's here in the Chicago area with me as well. So I wanted to thank Mary for joining us, and she's going to kick it off and share with us about this bill, SB 1950.
Right. Oh, Dr. Mendoza, thank you so much for having me. I'm very grateful to you and to Ted for everything that you're doing to try to make, very common sense healthcare principles applicable in the state of Illinois, because we find that we're such an outlier in so many different reasons. And when I heard that this bill had been called, I went to bed on Halloween night after trick-or-treating with my youngest, and at 2:15 in the morning, I got a message from a friend who works at the Illinois State Senate who said that the bill had been called at 2:15 in the morning, the assisted suicide bill in Illinois, and then voted on, I believe it was at 2:50 a.m. So again, we're into November 1st. So at almost 3 o'clock in the morning, and it passed by only one vote. And this is very typical for the Illinois General Assembly. I was very privileged to be part of a coalition several years ago when we had multiple, concerned parents of every religious background and no religious background whatsoever who were trying to keep the parental notice of abortion law intact in the state of Illinois. And the Illinois General Assembly did the same thing. They waited until the Friday before Memorial Day weekend, and then they called the bill at about 11 p.m. in the evening and then passed it by a very narrow margin, very late into the morning. And I'm sure that was because 78% of Illinois parents who had been surveyed about this particular law supported it, who said, no, it's common sense that if a minor girl is going to have an irreversible surgery like an abortion, her parents, this wasn't even about permission. This was just giving them notice. Her parents should know. They should be told, right? At the time I had three teenage daughters. So I felt very strongly about that. And then when I saw the assisted suicide bill being called again in the very dark hours of the morning where no one could, very few people would know and could object, and then it passes by one vote. I mean, this is how things are done in Illinois, and it's just wrong because we should be governing by consensus, right? I mean, that just makes sense. This is not a bill that had any consensus, and if anything, it benefits the insurance companies who perhaps don't want to pay the extra money it might take to care for somebody with a disability, or don't want to provide for that particular palliative care for someone who might have a terminal illness. It's in Illinois, it seems always to be kind of the cheap, quick solution to problems that might benefit the bottom line financially, but they really hurt the human person.
Yeah. Can you share with us more, like put in context kind of where this bill is with the movement across the country? I think it's 11 states and DC that have passed physician assisted suicide, which as a physician, I find so offensive because we take a Hippocratic oath to do no harm. And we have such a robust palliative and hospice movement that has been developed and has really been so helpful for people. But I'm just curious, because you're so expert in this area, if you could just share, about the movement in general and some of your knowledge about, what has happened in states like Oregon that
Right.
have passed
So,
this in their experience. So
right.
yeah, if you
So,
would please, thanks.
yes. So thank you, Dr. Mendoza.
Yeah.
So it started in the States and not unintentionally. The Hemlock Society, which is now has now rebranded itself as like Medical Aid in Dying, something like that. But back in the day, it was Dr. Jack Kevorkian and
Mhm.
the Hemlock Society, right? And they started in states specifically and intentionally in states like Oregon, Washington State, because they had the highest number of agnostics and atheists in their
Mm.
population. And so they intentionally began their efforts there, knowing that there wouldn't be the same numbers of objections that there might be in states where you would have people who have a particular faith tradition, whether that's Mormon or Christian or Jewish faith tradition. They knew that people with a particular faith perspective would have problems with assisted suicide. So again, they started in Oregon, Washington State, states like that. And, again, there were so many warnings at the time, even like, when Dr. Jack Kevorkian was first starting out, you saw there was kind of like, especially among medical professionals like yourself, just a national kind of repulsion. Like, what are they talking about? Like killing people? What?
Yeah.
And, it was just so abhorrent because
Yeah.
it's just so against what we would, I as a Christian would call the natural law, what others might just call common sense, I suppose, that like
Yeah.
we don't we if okay, so for example, you can kind of use the analogy to a woman facing a crisis pregnancy. Is the most compassionate, holistic thing to do to offer her an abortion, or is it to solve the crisis that she's in that's leading her to think about the abortion, right? So when a woman's faced with a crisis pregnancy, I, as a Christian, would say, no, you eliminate the crisis. You don't eliminate the child. The same with a person who has a disability or an illness, and particularly an illness that is causing them a physical pain, intractable pain. We have ways, and you would certainly know this as a physician, that we can moderate that pain and even almost remove it completely so that the person can live a life that's worth living, with the time that God's given them. It allows them time with their family. It allows them time to be able to wrap up as it were, practical aspects of their life, but to kind of cut short because we're so afraid of physical suffering that we want to just eliminate the person rather than eliminating the physical suffering, right? I think that tells us a lot about where society is, and a lot of this is driven by insurance companies, and we can't lose sight of that fact.
Right. And you bring up great points. And I think just pulling it back, what is the culture of medicine? It's a culture of life. And in our country with advanced uh, diagnostics, with big pharma that is always coming up with new cures, with
Right.
precision medicine out there. I mean, we've got some tremendous companies in Chicago like Tempest that is really trying to navigate this precision medicine with AI to come up with cures. So we represent a culture of life. So to insert this into sort of what I call the Pritzker like support of like death cults, or it's
Yes.
like, governor suicide. Like this is insane because it does not comport with the ethics of medicine or where healthcare has been going. Again, we have such a developed palliative care and hospice movement. And if there's issues with more coverage for palliative care, let's have those discussions. But I can tell you in the emergency department, I deal with end of life things all the time.
Right.
Even patients who, I mean, just all sorts of things. And so, part of in this bill that was so striking was that, they have basically the hospice language where, if you have a terminal diagnosis and are predicted to live within 6 months, you fall into this category. Well, first of all, I mean, that's the same as hospice. But with hospice, even, no doctor, no matter how expert they are, can tell you exactly when someone's going to die of a
Mhm.
terminal illness. I mean, I have seen patients live months, years beyond what someone said they would. So
Right.
to have that as part of this is absurd because nobody knows. And and to again, it's like basically what I see the difference with the way hospice is laid out is that it's just that, well, a doctor can write a prescription and the patient can just have the medicine and just take it at home when they want. Well, when you look back at Oregon's experience in other states, um, sometimes like patients change their mind and they don't take the medicine. They have no tracking of the medicine. They've put things in here that are just red flags that, again, experiences in states like Oregon, they've talked about in the proposed legislation. They're basically saying to lie on, they're allowing on the death certificate, it says you will not put assisted suicide. You will put what the person's terminal diagnosis is. So they're basically hiding the information. And that's absurd that our governor would sign something like that. So I just think that this is so against medicine. I mean, how would you trust a doctor when you know that the healthcare system would turn into even worse here, where a patient would be scared to, go into a doctor because they're going to be offered this. And then lastly, and I'll let you jump back in. I mean, I've heard stories in Oregon where a patient has cancer and the state of Oregon, probably managing, the state Medicaid or other policies are saying, well, we're not going to cover your chemotherapy, but we'll cover you for assisted suicide.
Exactly.
Okay. That is absurd and scary and should never be allowed in our state. Absolutely not.
Of course, and because we're seeing the financial bottom line superseding what's best for the patient, right? And so the right to die becomes the duty to die, and it disproportionately affects, Carrie, women of color, women who are poor, particularly women, and people who are poor, but also people with disabilities. I have one of my dearest friends is a physician in Chicago, and she's a neurodevelopmental pediatrician, and so her entire caseload, if so to speak, is children with disabilities. And she was telling me the parents of the children she cares for are terrified. She said I spend half of my she's a doctor, half of my week is spent arguing with insurance companies over procedures that like one of my patients with Down syndrome might need, or one of my patients with cerebral palsy might need, because now it's become, gosh, do they really need this? Do they really need to prolong the life of this child in a particular way?
Unbelievable.
And you have the poor parents who are beside themselves, who can't afford to pay for these things out of pocket. So the way in which it skews the I guess the eyes you would put on a patient, right? Do you see this as somebody who I can save? It might take a little more time, it might take a little more money, but I can save this person and give them a relatively painless and happy life for the next, say, 6 years. Or I could prescribe these, particular medications that will just kind of take them out early, and then, they don't have to suffer anymore, right? That's what we're always sold, is that this lack of suffering. And, we don't want people to be in pain, and we don't want them to suffer. But when you introduce assisted suicide into that equation, then you have a lot less motivation for insurance companies, for medical professionals to look for ways to alleviate pain, right? When you have this as an option, why do you need then to put more extensive research into palliative care, for example? It removes that sort of impetus to really care for the human person as a human person, and just robs from them those final days or final weeks or final months that they might have to spend with their family and friends. And you can't put a price tag on that. And maybe, for a particular person, a little bit of ache and pains every day when they wake up. I mean, that's everybody after a certain age, right? And I don't know when we all sort of kind of came to this conclusion that because you're a human person, you should never have to have any physical suffering whatsoever. It's just part of the human condition. Everybody has some pain at some point, you stub your toe, whatever, you get a hangnail. I mean, it can be as little as that, or as significant as getting something like bone cancer, which is incredibly painful. But the point is, we address the pain. We don't eliminate the person.
Right. And I, to really just reiterate the context, we have a robust system that's covered by insurance of palliative care and hospice care. It exists. So what is different here is that it's coercing the medical, institutions and the medical culture to basically say, well, a person wants the freedom for a doctor or a physician assistant or nurse practitioner to write a prescription so they can just decide, when they want to do it at home. Well, that is a line that is not crossed by ethical medicine. And if Pritzker signs it, it's just being governor suicide. And just a few last things I want to say within this context is that a lot of this euphemistic language in here is very, echoes the, transgender for under 18 child transgender issues, where if you don't do this, they're going to commit suicide. You need to do this to reduce suffering. And it's this euphemistic gender affirming care, which we know, is not true. So it's falling into these same buckets of just, really terrible, healthcare, trying to co-opt healthcare for these reasons. And then lastly, given that Governor Pritzker signed the bill related to mandatory mental health screenings for kids, is just absolutely frightening. Because first of all, we know that, is not belong in school, but if you cannot see the pipeline and the way that this all works out, you're not paying attention. I mean, in Canada, they are letting young people commit suicide or physician assisted suicide because they're depressed. And I know in this bill, it says depression is not, a category that's allowed, but we all know how this works. You have a terminal illness and you're depressed. It's depression plus, and then you've crossed a line that just should not be allowed. And if when Ted and I are governing, this just would not be allowed. It would be vetoed. We would be a strong moral voice, against this. So
I'm so glad to hear that. Because
a few more minutes if you want to just say a few closing things.
We know with suicide, Dr. Mendoza, and you know this well as a medical professional, there's a contagion aspect to it. So when you have, for example, a teenage suicide at a high school, there's so tragically often other suicides that follow because there's a contagion. Same with the transgender issue. You have one child coming out and then all of a sudden it's a social contagion. We saw this a couple of decades ago with anorexia, for example. And so while Illinois, and I think to its credit, Illinois has established this new suicide awareness hotline and for anybody who is feeling, but at the same time, we're wanting to legalize assisted suicide. That makes no sense. There's a contagion aspect even to the medically assisted suicides. And that we don't want more of this. We want less of it, right?
And Mary, I'm so glad you brought that up because, I was looking into a lot of these details, and in Oregon, of course, the suicides have gone up and the funding for the suicide prevention has gone down. Okay. So this insanity, Ted and I do not support that. This insanity, and this is outrageous.
But and then too, I think we need to also, and I'm so grateful that you and Ted are putting so much attention to this because we need to educate the general public. I have a very dear friend who is a hospice chaplain, has been for many years. And she had a woman who was, hospice nurses and doctors and chaplains can tell when a person's in the dying process. It is part of life, right? And so this was an older woman. She was in the dying process. She had some physical discomfort. The hospice chaplain moved in to talk to the doctor about alleviating some of her pain. And the family attempted to stop it because they were afraid she was going to get addicted. And this was a woman who died 24 hours later. I mean, I don't mean to, but God bless them. They were hoping to protect, their loved one from becoming dependent on opiates. But they didn't understand that their loved one was actively dying, and it would really take a medical miracle for her to live long enough to become addicted to the opiates that they were giving
Right.
her. But they could keep her lucid and understanding her surroundings, but also pain-free at the same time.
Yeah.
But the family was misinformed. And this kind of
Yes.
assisted suicide legislation, all it does is, it kind of triggers in people who might not, move in medical worlds, like, oh my goodness, oh, they have to have this or they'll die in pain.
Yeah.
People
Right.
who, are on our side of the ledger, like you and Ted, don't want people to die in pain.
Of course not.
Absolutely the opposite. And we can target and really specify pain control now where the person's pain is relieved,
Absolutely.
but we're not doing anything to actively take their lives.
Yeah. And I mean, I've just seen some of the most incredible people that work in the hospice movement. And as you said, we don't want people to unduly suffer, but this bill is about, covering state-sponsored killing.
Right.
Okay.
And
that
Illinois
is,
should be, we should be
that is
bragging
just,
about our
that is
medical
just
care.
wrong. That's
Right.
not, it's not saying that there are already hospice and palliative care services, and I welcome any discussions about how to improve those. But I can tell you from being on the front lines and the boots on the ground, there are just wonderful people involved, and that already exists in Illinois. So
Right,
our
it does.
state should not be sponsoring, killing.
Yes, and it's just
enlisting the medical community in this. It's just outrageous. So
right. It's simply not necessary in the state of Illinois.
No.
We have advanced, incredibly advanced,
yes,
medical care and palliative care and hospice care.
Yes.
We do not need to introduce assisted suicide for the benefit of insurance companies
exactly.
into the mix here. It
And
hurts everyone, but it especially hurts the
Her-
poor and poor people of color.
Right. And like you said, the disability community, and a no-go would not happen in Dabrowski administration. And I'm right there, with Ted. So Mary, thank you so much for doing this. We
My
really,
pleasure.
really appreciate it.
Thank you.
We want the best for, Illinoisans, and we really want to turn the tide and have an ethical and hopeful Illinois. So
Right.
thank
Where
you.
every
Yeah.
person matters.
Yes.
Dr. Mendoza, that's the thing. Every person matters. If they're sick, if they're disabled, you matter
Yes.
just as much as a healthy person here. And we want to, speak to the value of your life, the preciousness
Yes.
of your life, and just surround you with the care that you deserve, not an easy exit that makes it, a little bit easier for everybody else.
So well said. Okay. Thank you. And
Thank
we
you,
will,
Dr. Mendoza.
you are welcome. And we'll be live again with more issues next week.
Okay,
Thank you
terrific.
again, Mary.
Thank you for
Yeah.
having me. It was a
No,
pleasure.
my pleasure.